Hi, everyone. Thanks for being with us for this beautiful Wednesday, July 22nd briefing. Sorry we're a little late. We had a lot of information on the last call and it ran a little late. So let me jump into the stats here. Confirmed cases, 4,776. That's a plus of 102 over Monday. And Monday was a 123 over Sunday. The good news, if there is any good news, is that our deaths are holding steady. We have no new deaths to report. And it's been that way now for about 2 weeks. And even in the congregate care setting, we haven't seen a death in probably 3 weeks. And I attribute some of that good news to all the work that health has done in the congregate care setting and making sure that people were well trained and that the folks there knew how to operate under these circumstances and isolate people and make sure that they were donning and doffing the PPE properly. So let's hope that that holds true throughout the week. Just some other numbers that you might be interested in. We see the current hospitalization up around 77. It's a little bit higher than it's been in the past with 69 confirmed. But 22% of those, or 15 of those, are from out of county. And the positivity rate is up a little bit. Still, certainly within guidelines. It's at 5.1 as we approach 93, almost 94,000 now tested for COVID-19, and you see the turnaround time going down to 2.29 days, and certainly that will vary with various providers. I've heard some people say they didn't get their test back for 10 days and others had it back within 24 hours. So that will vary accordingly. I would invite all of you to go to the website. Health has done a wonderful job with the epidemiologists to update some of the most important metrics that the state is looking at, so people will have a visual and really understand where we're at. Let's see if we can pull one up here to demonstrate. So this one in particular shows a high alert where we're at, and there's an explanation above it. But there's several key metrics that are now up and running and updated on a regular basis for you to take a look at. What is disconcerting is that as a state, we have 400,769 total positive cases as of July 20th versus New York, which is at 408. So we're actually going to pass New York, it looks like, at some time on the positive cases. Over the last 14 days, the number of deaths in California are up 20% from the prior 2 weeks, 20% in 2 weeks. And the number of positive cases statewide are up 44%, which is staggering. The total number of people hospitalized with COVID-19 in the state was 7,091 on Monday, a 25% increase from 2 weeks earlier. So as a state, you can see what's going on, and I think certainly that's why the governor has taken some of the measures he has. But we are still here in this county doing well, much better than around the state, and certainly we are not on the watch list as of right now. That could change depending on how the numbers go. But right now we are faring better than certainly anyone else in the Bay Area who is on that list. In regard to the health facility numbers, we have 11 at the Burlingame ACS, and we will be moving to close down that facility within the next 30 days or so. At the homeless Bayfront Station, we have 90 guests with 81 rooms occupied, and we have another 88 guests around the county for a total of 178 individuals that are housed in various hotels, motels. The county varied testing, a total of 20,532, so 3,150 last week, a total of 314 walk-ups, and an average no-show rate of 11.5%. Testing hours have moved from 9 a.m. to 3 p.m. because of the state's limit of 500 per day cap on the testing. And the testing criteria by Verily has remained the same, even though that some of the criteria, suggested criteria by the state has changed. We have not changed in this county yet, and I don't think Verily has changed their criteria around the state. So that more to come on that. We're going to wait and see what the state's testing task force comes up with on that. For the rest of the week, we'll be in Daly City and East Palo Alto testing. So a couple of benchmarks, and Ms. Rogers went over some of these yesterday in the board meeting. I just want to reiterate what they are. Really, it's in regard to the state's watch list and what we're being looked at in regard to that watch list is really two areas that they focused in on, and that is the case rate. Yesterday we're at 105.7 cases per 100,000 on a 14-day rolling average, and that's above, ever so slightly above the benchmark for the state of 100 cases per 100,000. And how they came up with that benchmark is anyone's guess. I don't know if it's based in science or what they feel is best practice or whatever, but the Bay Area rate is at 109.2. And certainly we are well below the California average of 197 per 0.7 per 100K. So 190, almost 198 per 100K on a state level. And we are actually trending down slightly. July 17th, we're at 110. We are now down to 105 per 100,000. The other, and some of those things that, we believe are working clearly are the social distancing and the face coverings. And we know that there's a higher exposure for residents who perform frontline work. We're seeing that, and workers living in tight spaces with many family members, which make isolation difficult. So those are some of the causes of that. And then the variability in COVID positive hospital census yesterday was at 10.8. The state benchmark is 10%. The state looks at a 3-day average, and it's calculated daily. Currently, our capacity, as you can see in those metrics, is strong in our hospitals in this county. So it's something that we'll certainly continue to monitor. But right now, we believe we're doing well there, even though we're above the state average slightly. Contact tracing continues to continue to put that infrastructure in place, and as we indicated, that is a key factor. We had 30 in place. We now put another 45 in place as of last week. We brought on that large group, and we're in the process of training them now. And it'll take a little bit before they're at full capacity, but they will get there. And hopefully by August, we'll have another 60, which would put us at 140, well above the requirement of 115. So the goal is to achieve 90% connection with positive cases and 90% of their contacts. And we do expect to and want to report on this metric publicly when we have the capacity to do so. Just a couple of things on the board action yesterday. The Coronavirus Aid Relief and Economic Security CARES Act, $2 million for the Child Care Relief Fund was passed by the board and much needed. So that will start rolling out shortly. The extension of the countywide moratorium on rent, I think that everyone knows, will extend to August 31st. And an update on the implementation of the county's Immigrant Relief Fund. There were 7,500 applications, 5,000 appear to be eligible. 2,500 applications have been approved with 2 million committed to date. So that's a terrific 2,500 approved already. And families can receive up to 1,000 in aid through that process. And just as a reminder, the fund was seeded with 2 million from the county, the Board of Supervisors, and 5 million from private donations from Johnson Brado. I think another million came in on that, so I think they're up to 8 million on that. And the Mission Assets Fund continues to take applications at their website, and we're certainly happy to put that out there, what that website is. Submitted media questions. We've seen cities with greater voluntary restrictions in place, like San Francisco, be added to the state watch list. Is there any explanation or theory on how we've managed to stay off the list while expanding business operations? I think we have done a good job of really getting our media campaign in place and reaching out to people at every turn and imploring them, in many cases, to wear masks. I think that certainly we, in a lot of cases, compared to some other counties, are more spread out and maybe don't have as much of the congregate living, which is key to this, and at least in this county, key to where we see some of the spread going. I think to manage this, we're going to have to keep emphasizing, like we do every week here, that the social distancing, the wearing of masks, staying within the social bubbles is very, very important. And I think we've had good infrastructure in place too. I think that, we've had the opportunity to get many of our homeless off the street and into, more an individualized living situation. We've been able to spread out our shelter space. I think all these things add up and over time have an impact. Sarija, any other thoughts about why we're being successful, or anything you'd like to emphasize?
Well, we just have had great support for the core public health mitigation measures like case and contact investigation, the testing capacity that's ramped up considerably with the county's leadership and the state's resources. So we are in a Bay Area ecosystem, so we don't take for granted that the virus and how we live and work goes across county lines, but we're trying to keep pace and doing a pretty good job.
Great, thanks. The next question: officials have warned residents of the strong possibility the county could be added to the list rather soon, but a decision has not been released yet. Could you describe what these conversations have been like between the county and state officials, and if there's been any success in getting the state to be more lenient with the county? And I can tell you that, it could come at any time. I mean, it could be tomorrow, it could be the next day, it could be a week from now, it could be a month from now. We have just no idea, and it's really based on the metrics that they set up and the numbers that correlate to that. But I can tell you that Dr. Morrow, does believe that we're in a pretty good position here. That doesn't warrant the type of measure of closing more businesses down. And he has certainly advocated on the county's behalf that position to the state. We do not know what the impact of that is. Certainly we're not closed down as of today, but that could change. And I think that if you look at the metrics, we are close on many of them, but doing very well on others. So I think that you've got to take this. There's got to be a balance here, and the totality of the circumstances have to be taken into consideration. I'm sure that the other counties are looking at San Mateo County and wondering why it's different here and what are we doing here. And I don't think there's any magic to it. I think that hopefully those counties will be taken off the watch list soon also. Sarija, any other thoughts around the conversations?
No, and it's a dialogue with the state, and we're a very diverse state. We have a lot of different on the ground realities, county by county and in regions of the state. So work in progress.
Right, and I think the next question kind of dovetails into this last one also. Has there been success in getting the state to grant greater allowances for the positivity rates as we perform more targeted testing? And I think that's key, right? I mean, in essence, it could be a disincentive to test people, and that's not what we want. We want to make sure that we appropriately test people, but as you limit the amount of tests, that is going to impact the positivity rate on the other side. And we don't want that to ever play a role in our ability to go out and test in the hopes of keeping that positivity rate down. It is important that we go test. It's important that we test in specific areas and certainly in the hard to reach neighborhoods, along with the tests that Verily is doing around the county. But we have the ability, and we're building up the ability to go in and do specific testing if we see the need with different teams, whether it be a congregate care residential facility or an apartment complex that needs that testing. So we want to make sure that we're not penalized for not, for Verley's cutoff of 500 tests per day. And I think, like Sarita said, that continues to be a dialogue. And I think that certainly the state gets a sense that, there is an impact there, and is that fair to hold them to the same standard when there's certainly an impact on the decreasing test? So, Sarita, any thoughts around that?
Well, I would just emphasize that we in San Mateo County continue to be guided by the science and prioritizing the most vulnerable, prioritizing what's right to protect the public health of everyone. So each of these metrics has an interplay with other ones, and it's not just one metric alone that we look at in guiding the strategy.
Great. And the next question, is there any consideration of implementing restrictions countywide without a state mandate? And the answer to that is no, not at this time. Dr. Morrow has indicated several times that he will follow the state mandates at this point in time. The last question I have here written is, residents have been encouraged to turn to their private medical providers for tests if they can begin to feel symptoms rather than going to county sites. What is the protocol for private doctors reporting test results to county health, and does the daily case rate reflect all tests taken, whether performed through county sites or private doctors? The answer, as I understand it, is yes, and not only for in-county, but out-of-county testing done. Sarita, you might have more information around that.
Yeah, every test result for a San Mateo County resident is required to be reported to our public health lab. And every healthcare provider that serves San Mateo County residents has a way to make that possible for that result to show up in our lab. So it's all captured. And the additional benefit of having your primary care provider get the result is then she or he can guide you on what else should you be concerned about, whether that test is positive or negative. How does that correlate with other health issues that you might be contending with?
Right. And just to reiterate that, we do believe that people's direct actions can and have impacted our death rate. Not that we certainly don't expect another death to occur because of COVID-19. That would just be unrealistic, but we do know that the actions of individuals who are wearing masks and maintaining the social distancing and following the rules, and the businesses that are following the rules, and the restaurants that are following the rules, are having an impact on this. And again, I'm just so glad to see we've gone approximately 3 weeks without a death in a congregate care facility, residential facility, and another 2 weeks without reporting a death in general. So we just hope that trend continues, but it just underscores the important part that everyone in this community can play in stopping this virus and stopping this virus and stopping the death from this virus. So with that, let's see if there's any questions.
Henrietta Burrows, you've been unmuted.
Yes, thank you. According to the graph shown, the highest increase in cases by age is occurring among those who are 30 to 39 years old. Do we know what the hospitalization is of this group?
Yeah, Henrietta, I don't have a specific answer. We have seen a younger group in the hospitalized population over the last few weeks, and that's trends with our partners in the region and nationally, that younger people are being hospitalized. So age, folks at all ages have risks of getting pretty sick from the disease. I would just say that from our most recent case and contact investigation, it's the 20 to 39 age group that we see increased positive cases. And we want to keep reinforcing the key messages for all of you who are way younger than me in that 20 to 39 age group, that we all have to take those precautions, the wearing the facial covering, the 6 feet of social distance. I'm not hip enough to know how to say it in a way, but it's important for all of us.
As a follow-up question, is there a city breakdown by age of those infected? For example, East Palo Alto has like 401.
Yeah, I mean, we are presenting the data that we think are most meaningful, and we have we receive information on every single person's age and their residence of all the things that are most meaningful for guiding the response. That just isn't at the top of the list.
But is it possible to get that number, for example, for East Palo Alto, what the age breakdown is?
I don't
Been infected?
I don't think it would be easy to extract, Henrietta.
Okay, thank you.
Thanks for the question, Henrietta. Any other questions?
Those are all the raised hands we have at the moment. And I don't have any chat questions at the moment.
Great.
Thank you, everybody.
Thank you all for being on. Have a great week. Stay safe out there, and we'll see you next Wednesday.
Thank you.